Hey everyone, this is Erica Bennett with South Georgia Medical Center, and I'm here today with our President and CEO, Mr. Ronnie Dean. And we just wanted to get back on camera and connect with you and let you know what's going on here at South Georgia Medical Center and in our community. So Mr. Dean, with COVID-19 cases rising throughout Lowndes County, it's definitely been a hot topic in the news. Can you give us an update?
I can, Erica. There has definitely been a change, not only in Lowndes, but the surrounding counties. We're seeing an increase such that only a couple of weeks ago, we were experiencing single-digit patient volumes in our hospital. Today, we have 36. A couple of weeks ago, not as many intensive care hospitalizations. Today, we have 8. If there's a silver lining, not as many ventilator patients, but unfortunately, mortality has increased in the county and in our hospital. So we're at 25 deaths, whereas just a couple of weeks ago we were holding at 16, and then we went to 17, and now we're at 25. I guess the message is it's real. It can cause harm, and we should pay attention to these statistics. There is more we can do, I believe, but COVID has not went away. It just now is causing this effect on our community.
Mr. Dean, with cases increasing throughout Lowndes, what can our viewing audience and community members do to help deter this spread?
Erica, that's a great question. I think everybody's asking that. It's real. All right, so number one, let's believe it's real and it can hurt somebody. It's real and it kills. Secondly, let's understand the facts. The facts are 30 to 50% of us are walking around with it, but we're not symptomatic. And we're potentially spreading it to someone who has a clinical comorbidity, and if they contract it, it can harm them. At minimal, it can place them in the hospital and potentially they could die from it. I believe that's what spread is about. That's what's unfortunate about this virus is some of us don't know we have it. So what we have to do is act responsibly, and I've watched the community do this. I would reinforce the fact that we should socially distance ourselves from others. We should protect ourselves and others from us by wearing a mask always. Just wear the mask and help your neighbor not contract this stuff, and then wash your hands, don't touch your face, and clean our surfaces. If we do that, we'll slow this down a little bit. It's not going away. What we're trying to do is just spread it out over time so vaccines and all that can catch up. So I think that's my encouragement. I'd say don't fear, follow the facts. The facts are social distancing and masking help.
Last week we had a press conference where we announced the affiliation of Mercer University School of Medicine with our hospital. Can you elaborate on what that means for the community and this health system? I
can. It's a very exciting time. Mercer and South Georgia Medical Center have been talking about this for quite a long time. We're fortunate to have Mercer University as our academic partner in providing a graduate medical education option for physicians who need further training, and they can do it right here in Valdosta at South Georgia Medical Center. What it means to the patients that come in the hospital is that these doctors will be with our other medical staff members attending to their needs. So in a way, they become an extension of our medical staff, and the learning environment really creates an exploratory environment and an environment of understanding what it is we can do to better treat the patients that are here. So at the bedside, there could be a direct impact on the quality of care. Economically, what it does, these residents, they come here, they live here, and they're with us, and they buy things here. And so it's very nice having them here for those reasons. Just like other universities and colleges in town, these students come here to learn, and they live here in our community. But I think one of the most important things it does is it creates a pipeline of physicians for our future needs. And honestly, there is not enough physician supply for the needs of Georgia, let alone South Georgia. So Mercer teaming up with us to create another pipeline of physicians is very exciting in the sense that this health system will grow, our needs will grow, and we'll need more and more physicians over time. And that will be one pipeline of physicians that we can count on in the future.
Yes, I know we posted that last week on Facebook, and we had a huge response from the community.
Yeah.
Everyone's very excited about that. And then additionally, we have another good topic. Tomorrow is the hospital's 65th anniversary.
65 years. You know, it's 65 years young. If you think about it, you know, it's not that old. But that's a long time ago. 1955, the doors of the Pineview Hospital opened, 100 modern beds. I think there was about 30 some odd physicians on staff at the time. And could you imagine that we would have grown up to be what we are today? You know, a 4-hospital system across 3 counties and a myriad of specialty services, 2,700 employees, over 400 physicians on staff. I don't know that those founding fathers could have imagined that. But what we're celebrating is not only where we are, but what our future's about. And what we know is it's because of our employees, our volunteers, and our physicians that we've come this far. We have a supportive community. We appreciate everyone that counts on us, gives us an opportunity to serve. We believe the only reason we exist is to take care of people. The number one reason for a health delivery system to exist. And we're just excited about celebrating with our people. We're going to have a lot of food and fun tomorrow while we're taking care of all these patients that are coming in. And we're going to celebrate the 65th anniversary and look forward to 65 years more.
Thank you, Mr. Dean. 65 years is certainly something to be proud of. And I know that we have a lot of stuff even still happening coming up. Can you give us any feedback on what the future looks like for South Georgia Medical Center?
Well, I think it's bright. The community needs, desires us to grow, and our growth strategy is about serving the needs of this community and the region around us. A lot of things are planned, a lot more physicians coming. We have a lot of physicians interested in being on our staff, working in our facilities here and our other 3 campuses. New services are being planned, developed. And one item we mentioned a while back, we told the community we were adding or replacing linear accelerators and adding some capabilities. Well, I want to tell everybody we just have started our newest linear accelerator. That's a $6 million acquisition, so we can provide the very best cancer treatment right here in Valdosta, and Dr. Devine and the staff are treating patients under it today. And it's things like that that I think South Georgia, North Florida, and this region can look forward to from us. Our 2,700 employees and 400 physicians rallying around the needs of our community is a part of our future. And I just want to shout out again, Erica, to our 2,700 employees. They just do a wonderful job. They show up every day. They're committed to what they do. They're built for this, and we're very, very proud of them.
Thank you, Mr. Dean. In that regards, we do have a video that we're releasing tomorrow on our social media sites that just shows many of those people that serve in this facility throughout our campuses and care for this community. So be sure to check that out. We want to thank you for tuning in today. Please keep following us on our website and social media. We have a lot of things coming up, a lot of new physicians like Mr. Dean said, so check it out. Thank you again.